Welcome to this special episode of The Switch. My name is Lindsay Otto, Marketing and Communications Specialist at Nonprofit HR, and I am so excited about today's episode. We are going to hear from 3 women named to Nonprofit HR's 2024 Social Impact Women to Watch list. Each year during Women's History Month, Nonprofit HR is proud to recognize women across North America who have made significant contributions to nonprofits, associations, foundations, social enterprises, and the communities that they serve. This year, our Social Impact Women to Watch series features panel interviews with the 25 finalists named to this year's list. On today's episode, you will hear from Terry Stigdon, Lisa David, and Erika Stehl. They will be interviewed by Dr. Atokatha Ashmond Brew, Managing Director for Marketing and Strategic Communication at Nonprofit HR. And now, a little about our guests. Terry Stigdon is the Chief Executive Officer of the Indiana region of the American Red Cross. She is a true servant leader. Prior to her role at the American Red Cross, in 2018, she was appointed to lead the Department of Child Services, where she transformed how the agency functioned and worked with families and children in need. Before that, Terry had been a nurse for more than 20 years. Lisa David is the president and CEO of Public Health Solutions, where she leads the organization to support underserved families in achieving optimal health and building pathways to reach their potential. She has over 30 years of experience in the public health and healthcare sectors, and under her guidance, Public Health Solutions improves health outcomes among low-income families and communities by providing direct services such as food assistance, health insurance enrollment, maternal and child health support, sexual and reproductive health services, and more. Erika Stehl is the president and co-founder of Growing Love Community Garden that aims to empower individuals, create a support network, and promote healthy gardening practices that improve the environment and the continued beautification and restoration of public lands. Erika has a Master's of Social Work from Adelphi University and a certificate in organic gardening from the Cornell Cooperative. You're going to love this episode, and I welcome you to share it in your communities. You can find this recording at nonprofithr.com/The Switch. Now, without further ado, let's dive into the conversation.
Hello, and thank you very much for being on our podcast, The Switch by Nonprofit HR. We are so excited to be in this conversation with you all today. Congratulations on making the 2024 Social Impact Women to Watch list. We are just blown away by the work that each of you do, that you're currently doing in your organizations to increase impact. So I want to start off with some general questions that we have. What drew you to your organization's mission and the social impact space in general?
I can go ahead and get started. So this was really a natural progression for me. I've been a volunteer nurse for the Red Cross off and on since the impact of Hurricane Katrina. And when you look at the mission of the Red Cross, in a nutshell, it is to prevent and alleviate human suffering. So as a nurse and simply as a human being, it was really easy for me to see how can someone really not connect. Now, the timing at first was a bit off for me because I had a plan. I was leading a government agency and I had more I wanted to accomplish, but it really became apparent to me that the government agency was really ready for its next leader. And I had been preparing myself to lead in an organization that was even more aligned with my nursing and emergency management background and aligned with my heart for serving others.
Hi, I'm Lisa David, and it's also easy for me to answer this question. I have my whole life been driven by the need to have impact, and in particular, to be involved with changing the world for the better. That really came from my parents and the work they did and the activities they were involved with. And I always had an interest in women's health. I spent most of my career in women's health. And so the organization that I work for now, Public Health Solutions, I'm CEO, is involved with women's health and family health. In particular, we serve a lot of other people as well in New York City in ways that focus on the moment in time when a family is having a child and all of the life changes that entails and helping them get off to the best start. It's a moment when people are willing to do all kinds of changes in their life to do the best for their children. That just hit my heart, and I have been delighted to be there.
First of all, I feel like I'm an imposter being here with all of you wonderful women. I'm pinching myself. I also come from a background of social work. My brother is a medic. My mom was a hospice nurse and supervisor. So it's kind of our philosophy. I have a really strong interest in food and cooking and nutrition, and come from women who always had gardens and always prepared their meals. What I noticed as my family was growing and getting older was just in general in my community, this kind of disconnect from our food, where it comes from, our connection and reverence to the environment and the importance of that. And I had three interesting things that happened to me that pointed me in my path. And one of them was reading a wonderful book by Darren Jockey, who's a farmer who learned organic farming. And it kind of just sparked this little interest in me about the idea of a large community garden. That's kind of what he focused on. And then I went to Napa and was privileged to see one of their beautiful community gardens. And then I was volunteering for Island Harvest, and they were starting seed gardens in some real food deserts in Nassau County. It just started to get rolling. And I said, I don't know why we can't do this in our town. We have a lot of people who are about 10% under the poverty line, and a lot of people also living in apartments where they were unable to raise their own food. That's really where the motivation came. After that, it all seems to have gone really fast, finding a parcel of land that we could lease and getting our team assembled and on board to bring this beautiful community garden to life, which serves our local community. That was what started it.
I love the interconnectedness of your missions in the form of rescue and recovery, health and wellness, nutrition. What would you say is a little known fact or a few little known facts about your organization to help our audience become more understanding of what it is that you all do day in and day out?
I can continue speaking to that. I think one of the things that's really has been so eye-opening for me is how much people gravitate to being outside, to having a reason to connect with each other, to put their hands in the dirt. Love it. All sorts of organizations from town, Boy Scouts, the seniors, individuals. We try to really take our large community and have this great cross-section that could really connect with one another and also grow their own food. We have 46 individual plots. We have plots where we just grow food for our local pantry. We built a memorial garden, which is a kind of a quiet, contemplative space. And we built a children's garden over the last 7 years. And what each of those builds has done has given more of a reason for people to come out, to be together, to be outside in nature, learning how to grow things. So that's kind of where I'm coming from.
One of the things that really drives our organization in our approach and in its success is that the people that we're serving who are the most marginalized don't have a lot of understanding or trust in DOS systems where they would get help, whether that be government or healthcare or insurance. And so building trusted relationships is essential. We have the opportunity by focusing on newly formed families. We work with women, for example, in home visiting programs that start in their pregnancy and go through the first 2, 3, or 4 years of their child's life. So you're building that relationship with a family over time, and you can make sure all kinds of things happen, that they complete their educational goals, they're getting all their primary care. We get other services that they need set up. It has a huge impact on them and their lives. It's very different from somebody who doesn't have the opportunity to have that kind of a support relationship. And then the second thing that we're doing is hard to negotiate where to go and where to get help in a city as complex as New York City. And we've been building with community partners, community-based organizations in neighborhoods around the city, organizations that represent the full scope of social support services that are needed, and really formalizing those networks with an IT network and mutual agreements so that when somebody comes into this network, anything that they need can be provided. And the onus is not on them. It's always on the individual. But for many people, that's just overwhelming. And so we want to make sure that we can take care of all of those needs and take that burden off, because it's very challenging and complex. So that sort of trust, eliminating barriers is, I think, the key to having impact on issues of equity.
Well, and I'll just talk about how disasters really don't discriminate. I think about New York. So we have two wonderful women from New York, and you can think about Hurricane Sandy. No one saw anything like that ever coming to New York, but it resulted in dozens of deaths. And while disasters don't discriminate, in recovery, we can see a lot of inequities. The ability for communities and people to be resilient after experiencing a disaster really depends on what resources they have access to. And so with the Red Cross, instead of being very transactional, we come in, we tell you we'll do this, and then we leave. It is creating relationships beforehand, working with community leaders, and sometimes those informal leaders, the lady that lives down the street that knows what's going on in the neighborhood. She may not have a title, but she knows what's going on. She's one of the people that we work with to talk about the everyday disasters, which are home fires. We respond to home fires. We don't want anyone to die. So how can we make sure everyone has working smoke alarms? And really looking at how to be transformational in the work that we do as opposed to transactional. So just coming alongside and saying, we have this, can this help? And can you help deliver it on our behalf and be a Red Crosser along with us, with or without the logo or the title? It doesn't matter. It's about making communities safer. And then looking at serving equitably. So when we have a disaster, everybody needs a bottled water and they may all need a blanket. But we look at the folks that may need a little bit more and making sure that we can serve them so that they have the ability to bounce back a lot quicker, because the other group of people over here have access to and know how to get it a lot easier. So let us help those communities to bounce back, because the disasters, we're not a disaster cycle anymore. We are in a continuous disaster response. And I'd like to share with people that in the last 30 days, the Red Cross responds to 33 disasters. So it's not just a hurricane season or tornado season. Things are happening all the time. And so the best thing we can do as an organization is to help equip communities to be able to bounce back when it strikes.
Wow, I heard so much passion coming from each of you in your responses in this episode. It's really about passion and how it shows up in your work and how it shows up in your organization. What does passion mean to you? And how do you see that playing out in your organization and in the people who are serving your community?
This is Lisa again. People who work in nonprofits, and especially those that are close to the community, really value that connection to community and having an impact on improving the lives or the opportunities for people. So I always go under the assumption that everybody in my organization is there because they love the work we're doing, and they get reward from that because they're not living on the value of the salary I give them. They are living on salary. That's not what I'm saying, but that's not what motivated them, because they could make more money in other jobs. And so that passion lives throughout the organization at every single level, and is almost strongest at my frontline staff who are face-to-face with the folks in the community. They're in the same boat, actually. They really value, appreciate, and stick with us. I've got people who've been in my organization 45 years because that makes them feel good. That makes them feel like their day was well spent.
Right. Thank you for sharing that. And I love what you said about seeing it most strongly at the front line. It's incredible. Thank you for sharing that.
The idea of passion for me means being completely consumed by an idea or a goal. It's a feeling of creativity and wanting to bring something to life. It is what keeps me up at night, or what keeps my fire and fuel going all the time, constant thoughts of my day. The people that work with me in the community garden, because I also have an LLC, which is a for-profit that does community creative events, have two kind of different goals. I've found in the not-for-profit, the individuals who work with us are not getting paid. They're volunteers, and they are really aligned with the belief system, and they really want to be part of something that they see growing, that they see continually blooming, where we have goals that we meet, and that is exciting. I find like everybody brings a different level of passion, or passion for a different aspect for this particular community garden. For example, one person, we have a master gardener who does all of our perennials and plant things. And, she is wonderful at that, but she doesn't want to speak with anybody up close. We have a treasurer who is great with numbers, but can't plant anything. So everybody in that particular circumstance really brings something that they are really good at, and they are a piece of the pie that they want to be part of this greater entity. And it all just kind of fits together really nicely.
Thank you, Erika. When it comes to passion and your unique influence as a leader, how does your passion influence your leadership approach and decision-making?
So I think part of that is really keeping my team engaged and enthused and aligned with our original goals. There's the general goals and upkeep and, but then there's builds or there's programming or something like that. And I feel like we set goals, and if we have a positive outcome, people feel wonderful about that. I think we revisit what each person is doing in connection to each of that. And if it doesn't look like it's working, or if somebody is losing a little bit of their fire or feeling for it, we regroup and we address that. I think for me, really try and keep each member happy and engaged with what they do, feeling that they are having an integral process for whatever it is we're doing, for our meetings, for our fundraisers, for our, integration within the community, and so on and so forth. So I think part of that is like an accountability, keeping them happy, celebrating the wins, but also going back and regrouping when things are not working and maybe taking another approach.
It's Lisa again. I feel like my job as the leader is to paint the picture of the world we're trying to create or the aspects of the world we're trying to change. Like, this is our North Star. This is what we're going for. And to make sure that we're, taking steps in that direction and the goals and objectives that we set out for the year. And then my job is to actually bring that to life across the organization and give examples of how we're doing that. Wow, this person helped this family do that. Hey, we just started something new and look what that's doing. So it's like paint the picture, make sure that the steps are agreed to in terms of how we're going to move towards that, and then do a lot of cheerleading to make it feel live and real with the staff.
Yeah, I love what both of you had to share. And how do you align that with resource allocation? How does that play in your people being able to run with that idea that they have based off what you have set as a vision? Lisa, how does that show up in your organization as well?
I'm in one of the most challenging workspaces because the majority of my money is government grants. Not very flexible. However, we raise a bit of money and we use that very carefully to make these small investments and to build around those government programs, sort of link things to them and create partnerships to be able to do that. So my internal resources are largely allocated because they're restricted monies that come in, but we have like 5% additional funding from fundraising, and we have the ability to partner with other organizations to get other things done. And that's kind of what I do. That's my contribution to making sure we have a little strategic flexibility to move things in the direction that we want to go.
Thank you for that, Lisa. Another question I have is, do you have any examples of passionate leaders that have influenced your career?
Yes. So there are many. I have to start with my mom, who was in the baking industry and moved up to a VP position at a large financial institution and actually managed people in more than one country. And it was a male-dominated area. And she was very passionate about learning and understanding numbers and how they worked for you and not against you. But it is nursing week. And I would be remiss if I didn't bring up the two nurses that really have influenced me, Clara Barton and Florence Nightingale. And these, I would say, are probably the two most well-known, influential women in nursing worldwide. So Clara Barton was a self-taught nurse. And we like to say that even though she wasn't officially trained as a nurse, because she exhibited the vision and passion of nursing, she is a nurse. Self-taught still makes her a nurse. And she didn't take no for an answer. And you look at the history of Clara Barton, she pushed through and really made a name for herself to make sure that people in need, regardless of who they were, where they came from, or what they look like, were able to get the assistance that they needed. She has a quote that I love, and it is, "You must never think of anything except the need and how to meet it." And that quote, for me, speaks to her legacy of serving others and even how we should serve. And if you think about that short quote, it really can begin a thoughtful discussion on serving equitably, helping those who need it most first. So I love that she was ahead of her time and has a fantastic history. So if you don't know much about her, there are some great biographies out there about her. And then the same goes for Florence Nightingale. Just like Clara, she was a pioneer. She saw a need where soldiers were sick and dying from disease. And so she trained women to improve hygiene and living conditions in the Crimean War. And what really inspires me about Florence is that she loved data. So I am a data nerd. I can really get into what does the information tell me? And nursing is a science. And even when Florence Nightingale was bedridden in her late 30s from brucellosis, she continued to influence policy and practice, and that gave birth to nursing as we see it today. Both of these ladies were pioneers and fought through barriers to create opportunities for others, especially women. And so their passion really paved the way for women like me to be even non-traditional in our approach to nursing.
Thank you so much. Go ahead, Lisa.
I have many, many people in my life who've been inspirational, but two that really stand out to me. One is my brother. So that speaks to my mother's ability to raise incredible children. He was one of the co-founders, two people who developed the Highline Park in New York City. And that was, an old railway that ran up and down Manhattan that was slated for demolition by Governor Giuliani without any process. And he and another person fought to delay the demolition, to get the federal approvals to convert from rails to trail, to do a design, to raise the money. And it is like one of the premier tourist attractions in New York right now. Everybody said you couldn't do it. Why are you doing this? This is a bad idea. You're never going to get it done. And they did it, and not only got it done, but it's incredibly celebrated, has a huge impact globally on people thinking about what to do with the railroads. So that was one of like, don't give up on an idea that you're passionate about. People will tell you it can't be done, but it can. The second, I've had the privilege of working for two phenomenal women in my chair at Columbia Medical School at OBGYN, and then Cecile Richards at Planned Parenthood, who daughter of Ann Richards, governor of Texas, like two incredibly powerful, influential women. She came in at a moment where Planned Parenthood wasn't, center stage. People didn't really know it still existed. We kept hearing that, and put it back on track and made it, the extraordinary spokesperson for women in general and reproductive health and equity. Just an amazing speaker, willing to pound her fists on tables, but did it with grace and aplomb. I always like to say I channel Cecile Richards when I'm in a tough spot or if I'm giving a speech. She's just been a North Star for me. So they come in lots of ways and lots of places.
I appreciate all that you both had to share, Terry and Lisa. This question really speaks to what I heard each of you sort of lace through your responses, and it's all around equity and serving those who need it most, those who have the least. And I'm wondering if you can speak to that part of your work and how you are able to, at a time like we're in today, address some of those systemic gaps in our world, especially in some of the communities that you serve. I appreciate that each of you have lifted that up as core and central to your missions. And it would be great if you can share a little bit of that for our audience as well.
I'll jump in. All of the programs that we're engaged in were originally designed and developed to support those most in need and to try and help people in bad times. With the systemic issues that we have, people aren't only temporarily in bad situations. We have constant needs that have to be addressed. And I think the challenge is letting people have the voice, letting the community have the voice in what they need. Because a lot of this stuff comes down on an eye from the government saying, we've done research and this is the way it works. And it gives us sort of impression of we're going to tell you what you need as opposed to you telling us what you need and us helping you get that. Listening to the community, again, building that trust, I think are just incredibly essential to having impact. And it's hard to do in a meaningful way that you can actually honor in the delivery, but you got to make that investment. So we have a combination of ways that we do that. We get feedback from people who actually come to us. We do surveys in communities that we're not necessarily serving everybody in. We have advisory boards for each program, but people have to come in and recommend what they need, and they have to be at the table and be engaged in order to make change. And so we focus a lot on how to do that and how best to do that in the way that we're delivering our programs and designing, our approaches.
So this makes me think about the different arms we have of the American Red Cross. And one that I didn't really talk about yet was our blood program, our blood collection program. And we look at the 100,000 people or so that have sickle cell disease or sickle cell anemia. And as a nurse, being someone that has taken care of children with sickle cell, whether newly diagnosed or it is now a chronic illness that they're dealing with, I've seen them wait hours, days for blood that matches what they need so that they don't have to be in pain or be in danger of losing life or limb. And so blood transfusions are critical to their survival. At the Red Cross provides about 40% of the blood supply to the nation. And then there are several other organizations that also do blood collection. And what I like to tell people when I'm talking to them about, are you an organization that could hold a blood drive? I talk to them about the need of those that have sickle cell and say that someone in your organization might not know it and may have never donated donated, but they could be what is classified as a sickle cell fighter. They may have antigen markers on their blood that makes their blood a perfect match for someone with sickle cell. And that's why the people with sickle cell have to wait so long, is because we need more people of African descent to donate. And so connecting the mission to something that Lisa mentioned earlier about people being non-trusting of institutions. There are people that still, especially in the Black community, that do not trust healthcare organizations. There is this, well, what are you going to use my blood for? Is it really what you say you're going to use it for? I donated last fall and found out that I'm a sickle cell fighter. And it almost brought tears to my eyes, but it also helped me talk to my family, who they are not immune to not trusting medicine, even though I'm a nurse and my sister is a nurse, and talk to them about, you could donate and save someone that looks just like you states away. And you can save a 4-year-old from dying from a stroke or a heart attack because they have sickle cell. And so it's really connecting with not just those that work for us, but how do you connect with others to say, these are ways that the organization is facing issues that impact us inequitably. How do we help level the playing field to give someone a chance to be able to contribute in the way they want to? Sometimes it's just, can we just get them the blood that they need? That's separate from the disasters piece. But then I tell them, if you give blood, you help us fund operations so that people that can only give money, their money can go directly to the hands of the people that need it and that need it the most. So as we're looking at the impact of a disaster on a family or a community, we look at Florida, the hurricane from last fall, Idalia, hit one of the poorest areas of Florida, and they are still suffering from it. Well, we need to help these people. Socioeconomic status is really the big divider when it comes to recovery from a disaster. And so if we can help keep the blood drives going so that we can collect the blood, get it to the hospitals fund that program, that money supports those of us, the few of us that's paid. We're a very lean organization, lots of volunteers. And then the people that can say, I can't give blood, I don't really want to volunteer, but I can get money, then that money goes directly to help those that need it most. And so that's really a way that the American Red Cross is really trying to help address the inequity, especially when it comes to disaster recovery.
Something that you mentioned earlier, Erika, regarding food deserts, which I think people could consider that to be the lack of a grocery store in an affluent neighborhood. But it's so much different than that, right? So I was hoping you can speak to food deserts for those listening who may not be as aware of what that means.
The food desert is just an incomprehensible, system that has been set up where there is not adequate fresh food. There's not adequate grocery stores. It was really hard for me to wrap my head around this, that the best option for, people living in food deserts might be, 7-Eleven and having a big gulp in chips. It's really unbelievable. It's also very disheartening because when we were working volunteering with one of the school systems, it was in Jamaica, Queens, that was part of this food desert. And we were working with a school that was trying to grow a community garden, and we were initiating that they couldn't even plant in soil because they were underneath the jet stream of Kennedy Airport, and all of their soil was tainted. So it's on so many levels that it's just so hard to get beyond. Where we are right now in our town that has a lot of very expansive socioeconomic grouping, very poor to very wealthy. And what we're trying to do at the garden in our small space is trying to really bring people together and have them meet and understand one another despite language barriers, despite differences in education and jobs and all of that everybody has a seat in the table. And this is what we are all about. And it takes time. It's taken us years to try and promote that understanding. People come with so much incredible knowledge, especially from other countries. If they've been raised in farming communities, people in our own country have, that certainly come from the South, have a history of that, and we've lost so much of it. We're really, again, at our community garden, really trying to provide an openness, just a beautiful, wonderful space where people can slowly with time know that they belong there no matter what, whether you have a garden plot or not. We provide programming, which is free and paid for. And so we are doing what we can to really try and make people understand where, what we have and what we don't have. We're much more similar than we are different, and that we are really just trying to integrate each other and have a better communication process in general. And we all learn from one another.
Yeah, thank you so much for that. And I know we spoke earlier about resource allocation. I'm wondering if we can speak a little bit more to that in terms of how do you harness passion alongside business needs? Clearly, you three have really, really big missions that are serving many, many people. Can you share examples that you've seen and how this shows up in terms of that resource allocation?
I can talk a little bit, not so much, well, maybe it is resource allocation. I think about it, it depends. And so in my career, I've been in the hospital setting, I've been in the government setting, and now I'm in the nonprofit world. And it took me to get to the government sector to realize that I was created for service. And I had that paradigm moment in my career as I was sharing a little bit of my personal story and why this was so important to me, as I was looking at why do we want to make sure that we have enough families that are willing to adopt a child that's been in foster care, because children wait for families. And if we get that and have families waiting for children, then a child is never in a position where they feel unwanted. And so it's looking at how can we work with other organizations. So in government, you have to have partners. In nonprofit, you have to have partners. So we have to have partners. We're created for community. I won't go on about that. I would just say that foundationally is what I believe. And when I looked at how can we really make sure we have what we need for these children that are trapped in a very complex system of laws, we need to make sure that we help others connect to our passion and why we're doing the work that we're doing. And it was really listening, understanding, realizing my connection, sharing my own connection to the purpose of the work that we did, and encouraging people to say, well, maybe you can't adopt, but maybe you can provide respite. How can you support adoptive parents? And what organizations out there are doing a great job. And so if you can get someone connected, whether it's an individual, a small group, or a large organization, if you can get them connected to really your passion and why you do what you do, it will help improve overall what resources you have available to pull from to serve the people in need.
Thanks so much for that. I really appreciate you lifting up so much of the work that Red Cross is doing, because I know that people have seen Red Cross at the darkest hours, but may not be aware of how Red Cross shows up on a day-to-day basis. So I really appreciate you offering that intricate understanding to us for reflection. Another question that I have is regarding your talent management or people management philosophy. Most in our audience are HR practitioners or talent management professionals. So I'd love for them to understand a bit more about your people management philosophy, especially when engaging with mission-driven talent.
I can go ahead and start, and I will be very brief because I want to hear from the other ladies as well. Now, when I worked at Riley Hospital for Children at IU Health, I had a coach, an executive coach, and they shared a guiding principle of respect for people and continuous improvement. And it's actually written on my board here behind me because that is what I lead with and how I work with people every day. That has been my mantra ever since. We only have so many heartbeats on this earth. And with that, we should do all that we can to be a force for good. I love that. And so with the mission of the Red Cross, like I shared before, preventing and alleviating human suffering, keeping that in mind, I ask people looking to join this team, what about our mission aligns with your personal values? And I think about the leaders I learned about when I was at the hospital, and Matsushita Konosuke, who is the brain behind Panasonic, he led with 3 perspectives of management: do what is good for the customer, the company, and society. So if anything, that sums up how I lead and how I work alongside my team to ensure success. Looking at those 3, customer, company, and society, can you do all of that and do you align with that? And that is how I lead my people and push them and coach them and encourage them to not only become a part of the organization, but to make sure that they are putting the mission first.
I came into an organization that was very siloed. Each program saw itself differently. If I asked you who you work for, you wouldn't say Public Health Solutions, you'd say New York State WIC. And so I had over the last few years this goal of creating a single organization that allows us to integrate the programs and create multiplier effect. It's been taking very mission-driven people in a single area and trying to expand their view of how we as an organization are trying to have impact. For the most part, I see that as it's an enormous communication and engagement job the organization has to take on. I need to make sure that as we set our goals for the year and I'm presenting them to the board, that actually gets down to the frontline staff too, and that they can see that the work they're doing is part of this bigger picture. And then I need to tell them how that's going over the course of the year. We do a lot of engagement around our core values, a lot of the work that we've been doing in diversity, equity, and inclusion, which we call our empowerment work. We make a lot of groups. We get together several times a year and we're talking about, well, what does it mean, this value? And how do you make it live in your space? Give me some examples. So I think the way to engage people's passion, particularly when, the work is hard and you're not paid well, is to make you feel like you are a part of, this is a family. You're a valued part of that. And you have all these connections. And then I think you're getting the benefit of all the ideas and the approaches and their experiences, and we're applying that back to the work. Making things live, not just saying them, is an important part of really engaging people.
Yeah, I love it, Lisa. I love it. And I think you started to answer my last question, which has to do with the advice or insights you would offer emerging women leaders in organizations seeking to cultivate and harness passion for their mission to drive positive change. As we've said on prior episodes, many women are listening, they're watching, and their name may never make it to this list. They may never make it to a list of women to watch or professionals to watch, but no doubt they are doing powerful work. What could you offer up for them to consider?
I would just say, take the first step. Take the first step, not knowing the second step, not having any of the answers sometimes. The case that I have found is that you do find your tribe, and the people that are aligned with you will find you. I think it's really interesting and important to recognize that we all have different strengths, and being open to what the people in your team want to say and want to share, because that will grow your goals more than you ever realize. But taking the first step, making the first phone call, I think if we were to know all of the roadblocks that would be in our way before we made these big steps or jumped in head first, we'd probably be nervous to do it. And I think sometimes people want to be part of something bigger, or they want to join forces with you. They just don't know how. And so you kind of have to be that person and not know all the answers at all. Just kind of move with yourself and know that you will get there.
Thank you, Erika.
Terry? I would say know what drives people and know that requires flexibility in your approach. Don't lump people into a category. I think that it's become too easy lately to just make assumptions based on generations. We just need to stop that. I consider it a privilege to connect with people in a way that lets them know that they are seen as individuals, that each one of them can drive positive change in their environment, and you multiply that person by person and then minute by minute, and this ripple effect could be one that can be sustained beyond your lifetime. And so think about that legacy you can create when you can connect to people and help them see that as an individual, I can make change and not have assumptions made about me that could limit me working in your organization.
And I would just say for women, it's interesting because I think the women's issues from the time I came into the workforce as the old lady of this group, it's really, really changed. And I think women are listened to much more than they used to be. On the other hand, we're not always as confident and outspoken as we could be, because women tend to sort of think about what if, or would I get in trouble for doing something? So I would say you have to be bold. You have ideas and you have vision. So you want to be able to share that and to be able to communicate that. And you should be bold about that. And if something that your organization is doing is inconsistent, you should raise the question. But you need to figure out, even though you're really passionate, how to do that with grace, how to do that without being attacking or judgmental. It's the combination of having the passion and being able to throw the issue on the table kind of calmly with a story or some data. And that really makes you effective. That combination is incredibly powerful. And if you're someplace that you don't feel like your vision and the way you think things should work is inconsistent, then, that's meaningful. It may be time to think about something else. So be true to your vision, be true to yourself, be courageous, and do it with a little grace.
Wow. Lisa, you just opened up a whole other Pandora's box. Terry, I see you have something that came to mind as Lisa was talking. Would you like to share it?
Yeah. So as Lisa was talking, it reminded me of a book I read called The Myth of the Nice Girl. And it was about how women leaders don't have to be mean to be effective. Like, it is okay to be kind and compassionate and be very effective and drive the mission and be successful. It's kind of a fun book, but if you have a group of women that like to do book clubs, women leaders especially, or looking to be leaders, it would be a fun one to do.
Great suggestion. I just thank you so much for everything that each of you have lifted up. It is so very clear why you were on the list. And I'm so glad that we have been able to shine a light on you and the work that you're doing, your passion, your focus on leadership, and the organizations that you're serving. Thank you so much for being here on The Switch by Nonprofit HR. It is our honor to spotlight you.
That's our show for today. I think this was a fabulous episode that captured passion, not only each woman's individual passion for their mission and how that informs their leadership styles, but also in the way that they understand how their people's passion shows up and harnessing that as an essential part of the bigger picture, which is driving impact for their mission. Thank you for listening to The Switch. If you're looking for more episodes, visit nonprofithr.com/The Switch. There you can access recordings and resources to help your organization maximize its greatest asset, your people.